So, today, we're going to talk about something that sounds like it's straight out of science fiction, using a high-pressure chamber to flood your body with pure oxygen to heal wounds that just refuse to close. But here's the wild part. This futuristic idea actually has its roots in a completely accidental discovery from a very different kind of deep dive.
So, this is where our story really kicks off, with this strange observation from the world of undersea exploration. Divers living under the intense pressure of the deep noticed something really bizarre and kind of wonderful about their own bodies. You know, it was just this little clue, but it ended up sparking decades of scientific research.
Okay, so how do you go from a bunch of divers swapping stories to an actual legitimate medical treatment? Well, it all started when scientists decided to take these underwater stories seriously. And that's the key, right? This is where the story becomes science. Guys like Dr. T.K. Hunt started digging in, trying to figure out why this was happening. And what they found was the first real proof of something that seems so obvious to us now. You just can't heal right without enough oxygen.
So that brings us to the how, the nuts and bolts of it. If not having enough oxygen is the problem, how exactly does hyperbaric oxygen therapy, or HBOT, fix it? Well, it's really about hacking your body's own delivery system.
All right, so the bad guy in this whole story has a name. It's called hypoxia. I want you to think of it like a cut fuel line in an engine. Your body's healing machinery, all that complex stuff with cell repair and growth, it just stalls out. And for so many of these stubborn wounds, that's exactly what's going on. They just won't heal.
And this is such a great way to see the solution in action. See, on the left, that's normal conditions. Oxygen is kind of like a passenger on a bus. Those are your red blood cells. But if the road, your blood vessel, is all banged up, that bus just can't get through. It's stuck. Now look at the right. This is where hyperbaric oxygen therapy completely changes the game. With all that pressure, it literally dissolves massive amounts of oxygen right into the blood plasma itself. It's like the entire highway becomes a river of oxygen that can just flow around any roadblock and get to tissues that were totally starved before.
And this analogy just nails it. Yeah, we're not just talking about refilling the tank. This is like hitting the NOS button for your body's healing engine. A turbocharged boost to kickstart the whole thing.
Okay, so you've got this incredibly powerful tool. Where do you even begin to test it? Well, the scientific community found the perfect, and maybe the toughest, proving ground out there, the diabetic foot ulcer.
Yeah, these diabetic foot ulcers, or DFUs, became the ultimate test case. They are just notoriously hard to heal, because diabetes messes with the body in so many ways, including, you guessed it, damaging blood vessels and causing hypoxia. The thinking was, hey, if this therapy can make a difference here, it can probably work anywhere. But the story of the research isn't this clean, straight line. It kicks off in '79, and there's this real spark of hope. Then the '80s roll around, and there's this huge wave of optimism. Studies are showing these dramatic results. But then, as we move into the '90s and 2000s, the science gets better, more rigorous, and things get messy. You had some studies showing incredible results, and others showing basically no benefit at all. And so the whole scientific community was kind of left scratching their heads, going, what is going on here?
And to see why everyone was so excited, just look at these numbers from an early study. This one's from 1987. The amputation rate for patients who got HBOT, just 11%. Compare that to the control group, a staggering 40%. I mean, think about that. Those aren't just statistics. That's the difference between keeping a limb and losing it. It's absolutely life-changing.
So, that's the big question, right? With numbers like that, why was there any debate at all? Why did all these other studies seem to be all over the map? This was the central mystery that researchers absolutely had to figure out.
And it turns out, the answer was kind of hiding in plain sight the whole time. See, the problem wasn't really with the therapy, it was with how everyone was studying it.
Here's the big aha moment. The answer wasn't if it works, but for whom it works. The reason the results were all over the place was simple. The patients in these studies were all so different. They were lumping everyone together, people with mild wounds, severe wounds, all kinds of different blood flow problems. It was like trying to test one single key on 100 different locks. Of course it's not going to work every time.
So the solution wasn't to throw out the key, it was to figure out which lock it opened. And that's what this is, a modern clinical flowchart. It's the system. It literally walks doctors through a series of questions. Is the wound severe? Is the blood flow okay? Has standard care already failed? And it helps them figure out if this specific patient is the right match for HBOT. It's precision medicine, plain and simple.
So, who is that right patient? Who is this for? Well, the guidelines are actually pretty clear now. We're talking about really severe wounds, what they call Wagner grade 3 or higher.
This means the ulcer is deep, it's often down to the bone, and there's a serious infection. And crucially, this is for patients where the usual stuff, standard care, has already been tried for at least a month and just isn't working. So you see, HBOT isn't the first thing you try. It's a heavy hitter you bring in for the toughest cases.
And what's cool is that this whole idea, this principle of picking the right patient, it's not just for diabetic ulcers. It's really the golden rule for using HBOT for a whole bunch of other really tough conditions too.
Take arterial insufficiency ulcers, for example. These are wounds that pop up because clogged arteries are literally starving the tissue of blood and, yep, oxygen.
Then there are really rare diseases like pyoderma gangrenosum. This is a nasty one where your own immune system basically attacks your skin, creating these awful, fast-growing ulcers. The oxygen boost helps calm that inflammation and gives the healing process the fuel it needs.
And surgeons use it too, to help save skin grafts and flaps that are in danger of failing. You flood that area with oxygen, and you give that fragile new tissue the absolute best shot it has at survival.
You know, this whole story of hyperbaric oxygen therapy leaves us with a really interesting big-picture question about the future of medicine. We're getting so good at inventing these powerful new tools and treatments. But maybe the next real challenge, the next big frontier, isn't just invention anymore. Maybe it's about mastering the art and the science of perfectly matching these amazing tools to the exact person who needs them most.